honored guests, distinguished members of the Kenya Dental Association, and fellow dental professionals. It is our great pleasure to welcome you to the stunning shores of Diani for the 42nd Annual KDA Scientific Conference and Exhibition. We are thrilled to host this year's prestigious event, and we warmly welcome you to this beautiful gem on the coast. This year's theme, Advancing Excellence in Dentistry, Navigating Ethical, Technical, Legal, and Professional Frontiers, resonates deeply with us. As dental professionals, we are constantly challenged to stay ahead of the curve, embracing innovation while upholding the highest standards of ethics, professionalism, and technical expertise. Over the next few days, we will explore these vital frontiers together through engaging sessions, hands-on workshops, and valuable networking opportunities. This conference is designed as a platform for learning, sharing, and sparking new ideas that will shape the future of dentistry in Kenya and beyond. To our sponsors and exhibitors, thank you for your continued partnership and support. A special thanks to the organizing committee, whose dedication and hard work have brought this event to life. We appreciate your commitment. As we begin this exciting experience together, I hope you'll make the most of what the conference has to offer and take some time and enjoy the beauty, the hospitality, and warmth of Diani. Once again, I welcome you all to Diani and to the 42nd KDA conference. Enjoy the conference, enjoy the coast. Let's begin our first session by welcoming our first speaker of the day, Dr. Tonnie K. Mulli. He's a senior lecturer in periodontology and implant dentistry at the University of Nairobi. He's also the owner and lead consultant at the Periodontist Dental Center and Dental Tune Center. With a passion for mentorship and education, he has dedicated his career to advancing clinical excellence and shaping the next generation of dental professionals. His work bridges academia and private practice, combining evidence-based care with a commitment to patient-centered outcomes. Today, he will be speaking on the topic, Advancing Excellence in Dentistry, Navigating Ethical, Technical, Legal, and Professional Frontiers. Please join me in warmly welcoming Dr. Tonnie Mulli. Thank you.
Good morning, and I'm so glad to be here in this beautiful place. The weather is just perfect, and I'm hoping that we are going to have a good time. The responsibility of being the first speaker is that you stimulate all the hormones and chemicals for nervousness and everything, but we are doing good, aren't we? Yeah, so I thought maybe before we proceed, we are going to have an interactive session as usual. And so you better pair up about 4 of you, just 4 of you. 4, if you don't have 4, you have 2. And I want you to think about something that you think has happened in dentistry in the last 10 years in this country that has affected you, whether negatively or positively. And just discuss that a little bit, and then we see what we have. Just something that has affected you, something that has come in, whether it's technology, legal issues, media, politics, whatever it is that is affecting you as a dentist, your practice, and generally the profession as you know it. So just let's get started. It's just 2 minutes. And please get a secretary and let them write it down.
Let him come in until then.
I'm listening.
You want the physical toll on a dentist with his age, as he grows older. No, the physical toll. Very nice.
Chris, hi. Hello, how are you?
Uh-huh. $40. And please choose one person. We are going to have like 5 people just to give us an idea of what has happened. So make sure you choose one person to come and represent us. And the mic ready for. All right. So we have Jethro right here in front. Please come and tell us. So I'll just pick randomly, right? Okay.
Okay, what my group has come up with is both positive and negative. On the positive side, we've had uptake of technology, the scanners, the sensors in the last few years, which has helped us improve our workflow and share information with our colleagues, both within and without the country. On the negative aspect, we've seen very many quacks do all manner of things, specialized work, do orthodontics, do endodontics, and some have failed spectacularly. Finally, we've seen a large number of dentists being turned out in our universities. That's a positive development.
Great.
That's what I came up with.
Thanks. Let's just give him one clap. Good. All right. So he's raised some technological and some legal issues there. Quacks, legal, regulatory. Okay. Uh-huh. Let's see. Who do I go for? Dr. Moore.
Thank you. We have also more or less looked at seeing technology has come up, and we have used it to advance dentistry. That's the positive part. But on the negative ones, one is what the other group has said. Dentistry has been invaded by strangers, and they call themselves dentists, and they have brought a lot of challenges in the practice of dentistry. The other one has been the absorption of young dentists, even the old one, into the labor market has been a challenge. Some may go without laying their hands onto something. The training space has expanded, and that is positive. The other one which we have seen is positive is I think there are many outlets where people can go and upscale their skills and enable themselves to practice dentistry well. I think that's it. Thank you.
All right, one clap for him. I think being a teacher, he was going to finish the presentation today. All right, maybe just one more. Yeah, right at the back. Thank you for offering.
Good morning, everyone.
Morning.
My name is Dr. Burhan. I'm a Ugandan, but I'm practicing here in Kenya. You told us to discuss in groups, but I don't know anyone, so I discussed alone.
Oh, okay, very good.
So I have one negative feedback to give. I'm a Ugandan, a member of the East African community, currently practicing in Eldoret. As a community, we haven't been friendly to our dear neighbors. The annual practicing license for a non-Kenyan was initially 3.5 what a Kenyan pays. So that is 35,000 annually. And last year, without any prior notice or explanation, the annual practicing license was multiplied by 5. So we are now paying 50,000 without any notice or without any prior information. So I feel like it has affected some of us. We might be the silent minority, but we are there and we are serving Kenyans. So if there's anyone from KMDPCU, please give our feedback. The positive is I'll talk about my university, which is Moi. We have new programs there that are ongoing. Oral pathology, which is what I'm currently studying. We are growing dentistry in that university and hoping to have specialists coming from other universities, not necessarily Nairobi. Yeah.
Excellent. Okay, cool. Thanks. Let's give him a clap. Right. So I can hear some regulatory issues there, communication, and all that. So I think my experience, I'm just going to take two things. And this will be in the form of investing in modern technology and how that has impacted my practice. And so a few years ago, I went for that machine down there. How many know what that is? Just raise your hand. Just raise high enough. I just want to see. Yeah, okay, good. So just a few people. And that machine is the most advanced scaling, polishing machine that you can find anywhere. It's totally painless to the patients. And that by itself has really improved patients' comfort and uptake for scaling and root planing. And I'm able to reach levels in the pockets that I couldn't do with my regular scaler. Okay, and in a very comfortable way. Even without local anesthesia, you can really go down in the pockets. And the polishing using the airflow, I have never seen anything like that because it's going to remove every single stain in that mouth and it can clean interproximally. So when I did that, every time, it's not me asking the patient, but they're like, I've never had such deep cleaning, such thorough cleaning, such comfortable cleaning. I'm always afraid of having scaling done, but now I'm going to be coming. And some of them even go ahead and say, no, I'm not waiting for 6 months. Can I come 3? I'm like, of course. I want you to come 3 months. Yeah. And that makes a big difference. That's what technology has done for me in a few years. The other one is the iTero scanner for Invisalign and any other, of course, restorative work and all that. And that, again, has really changed how we do things. Digital scanners are here now to stay. The stories about, accuracy, whatever, they're doing a great job. I do not know the last time. I have many years now since I took a normal, regular impression. And that works. And the beauty about it is when you take the impression with a click, you're in communication with the lab. And that's it. There's no ndudi in between. And I'm hoping, I was just suggesting maybe for us who are using digital technology, maybe the lab should reduce the cost a bit because their logistics is reduced. They don't have to send a motorbike to come and pick the work. So you can cut off 500 bob. Yeah, Raj is here. Yeah, 500 bob from the cost of the lab work. And then we can pass that to the patient. So those are some of the things that have happened, and it has changed. And that's technology. We really welcome it. Okay, there has been a serious evolution in dentistry. We know that people used to really have it rough. And throughout the years, things have happened. Handpieces have come, high-speed handpieces, suctions. Oh, those things were not always there. But constantly people are thinking about this. Patients are worried about pain, cross-infection, etc. But technology is catching up. Regulations are changing, and that is really helping our profession. As you can see in this case, that patient doesn't have to feel pain, they don't have to feel anxious, and that means if you tell them to come back again, they will probably come. Yeah. Pain is what keeps patients away. And so by the end of this session, I hope you will be able to highlight ethical considerations shaping modern dental practice and explore emerging technologies, transforming diagnosis, treatment, and efficiency. Also examine legal and regulatory obligations governing dental professionals, and emphasize the lifelong learning, collaboration, and leadership. And finally, I hope we can propose together a framework for sustaining excellence in dentistry. Okay. So in the changing face of dentistry, the fact that everything is evolving so fast, there are things that are happening in technology, ethical issues that are happening, like we've raised them up here, professional things, like somebody has just mentioned my age, and they were like, as the days go by, doc, your sitting position, etc., things that are happening in the profession, we need to be able to address them. And now patients are more informed. It's not like before. Yeah. Regulators, they are more demanding, like you've just heard from our colleague from Uganda. And then technology is very disruptive. So what happens if you decide, I'm not moving with technology? I just want my old normal way of doing things. Okay. So a dentist in this generation now has to balance between these 4 C's, and that is compassion, competence, compliance, and continuous learning. If you don't balance those 4, then you're going to be in trouble. There are ethical things in there, there are things that are technological, etc. Okay? So, what are the pillars of dental excellence? Okay? So, these are clinical competency, ethical integrity, legal compliance, technological innovation, and lifelong professional development. Those are the things that really, the pillars of, okay, I'm having a slight challenge there. All right, cool. Yeah. So those are the 5 pillars of dental excellence that if you address each one of those, then you're doing very well. And so I want to go in sections where I address each one of these aspects, if it's ethics, if it's technology, etc. And so in section 1, I want us to look at ethics at the heart of modern dentistry. And I want us to look at the core ethical principles. For example, autonomy of the patient, respecting the patient's choices, and making sure you have informed consent. And not most of us get informed consent. Even the fact that the patient walks in, tells you what they're suffering from, you make a treatment plan and you just say, sit down here, let's do this. That is not consent. You need to be able to explain to the patient that they have a right to accept this treatment or refuse it. And that has to be very, very clear. Then there's the issue of beneficence, which means acting in the patient's best interests. And you're going to find this very interesting down the line when we look at this. Non-maleficence. I'm not an Englishman, but yeah. You promise not to do any harm. And for example, in this case here, I copied this from our WhatsApp platform. You remember this case? Yeah. One of us posted that molar there, and the patient had been told they've been done root canal treatment. In fact, 2 sittings. You remember? Or did I get the message wrong? But you remember that. Yeah, so what do? Do no harm. That's what we are saying. Okay? Justice, where you have fairness and equity in care delivery. Now, that's going to be a big challenge, isn't it, when you come to public hospitals, etc. And then there's veracity, where you have honesty in communication and records. So, what was this patient told? What kind of information were they given? So, those are things we should be able to address. All right. So, what about the real world ethical dilemmas? For example, pressure to overtreat or upsell cosmetic procedures. Patients who have insurance and they walk in and you're like, there's a small little pit on the back, or not really carious, but stained. Do I put a filling? Do I not? Yeah. And you have to make that ethical decision. Managing confidentiality in the digital era. You can be hacked. The records can be easily accessible by other people who are not supposed to see it, etc. What do you do? Then you're also thinking about dealing with social media, feedback from patients. When they say, that place when you go, you stay for 3 hours before you see the dentist, and they give you 1 star. Yeah? Or never advise anyone to ever go there. What do you do? And it's there online. Do you call the patients, call them? What? Do you kick them out of your practice? Do you sweet talk them and tell them, come on, just come next time, free consultation, I'll do cleaning for you for free? What do you do? Because these things are here now with us. And then we are balancing patient affordability with practice sustainability. So how do you charge? How do you decide how much to charge for that root canal treatment? Is it going to keep people away? Is it going to help people? So those are things that you need to think about. And just to show you how tricky this is an ethical crossroad, really. What would you do to a patient like that who insists that I need an extraction for this tooth? How many would extract that tooth? All right? Nobody. But then the patient says, please extract that tooth because I just don't have money. I don't want to put money into this. And in fact, some of these patients can afford, but in their mind, if a tooth hurts, extract it. As they say in Swahili, meno ikiuma, ngoa. So what do you do? So how do you balance autonomy with beneficence? That you're going to do good to this patient, and at the same time, you don't want them to go home with pain, etc. What ethical steps can you take? Those are the questions I'm sending back to you to think about and address. How do you document the decision, for example? A lot of us discuss a treatment plan and we don't put it down in writing. Yeah? I would expect you have your history, past medical, past dental, the way we taught you at school, yeah? And you have your examination, extraoral, intraoral, and you have all those levels of information on your patient's card, and your diagnosis, prognosis, and sequential treatment plan. That's what we expect in your notes, and then move on from there. So what do you do? All right. So what are the ethical principles at play here? Autonomy, for example. The patient has the right to make decisions regarding their own body and treatment. They have that right. You can't force it. But in terms of beneficence, the dentist has a duty to act in the best interest of the patient, preserving natural dentition when feasible. Yeah. And then what about do no harm? Avoid unnecessary extractions that could negatively affect function, aesthetics, and the long-term oral health. And finally, justice. This is something that is part of this story. So you ensure fairness. Consider the socio-economic context of this case, access to care, and explore affordable alternatives. There are those moments where you have to refer the patient probably like to a good established public hospital. Like you can send them to Kenyatta. We have excellent dentists over there, facilities and all. You can send them to the dental school or university hospitals, and the patient will be helped at a very fair price. Yeah, so that should remain an open option. Okay, so just discussing, I want to really use this case as a cornerstone, just to show you how sometimes you have to think like balancing autonomy and beneficence, respect the patient's autonomy without abandoning professional responsibility. And how do you do that? Communicate the clinical implications of extraction versus restorations. E.g., what are the future costs? For example, this tooth will end up having to do root canal treatment, prosthetic options, they may have to have implants, they have bone loss, etc. So, and all those will increase the cost. But please do not coerce the patient, okay? And the ethical and professional steps to take, assess the understanding of this patient, because you may think the patient truly understands what you're talking about. Just talk to them, see whether they understand. Language barriers, address those. Ensure the patient comprehends the prognosis and consequences. Provide education, for example, use models or visuals to illustrate the outcomes. Explore alternatives like ART, for example, if it's possible. You can even talk about payment plans with the patient. Can I do this? You just pay 1,000 today, and you can bring the next time like that. So see whether you can do that. Are there cheaper materials? Yeah, that are still within safety levels. So you need to think about that. Referral to a training institution, as I said, or government clinic. Of course, government clinics sometimes are not fully serviced, but I'm sure there are some, like in Nairobi now, we are doing very well. And then you can seek a second opinion if necessary to validate the decision ethically. And then document discussions carefully to protect both the patient and the practitioner. And that is a place where we fail, a lot of us. You need to document that. Patient referred to the dental school because of costs. You put it down, yeah? All right, so for example, in this documentation, because I really want to push it, include in the clinical notes, okay? Include that in the clinical notes, even the diagnosis and the prognosis of the tooth, details of discussions about treatment options and costs, put it in there. Even the evidence of informed consent, signed or verbal, with witness. And beautiful thing is you can always use your assistant as a witness, okay? And then you put down there the patient's final decision and the rationale. Why are they thinking, just extract this tooth? And then the dentist's professional recommendation. Even if it is declined, put it down, write it in there, that the patient refused. For example, this is what you can write, just a statement, discussed restorative versus extraction options, patient informed of long-term consequences and alternative cost options. Patient opted for extraction due to financial constraints. Informed consent obtained. And then you move on. That way you're safe and you've done your due justice to the case, okay? And so I want you to reflect on this. How would extracting the tooth compromise professional integrity if you did it? How do we address systemic barriers that make ethically ideal care unaffordable? Yeah. And I'm sure a lot of us have been in that situation where you really want to help, you know what you need to do, but you're not able to do it ethically because of systematic barriers. What do? You're in that government hospital. Afford the treatment. What do? What is the role of empathy and advocacy in such scenarios? What can you do? We are here, and I think one of the reasons why we are talking about this is because if we have leaders, they're listening and they're seeing the challenges that we are facing, and they can be able to go and address this. We have Shift, SHA, and all that stuff. And is it a barrier or is it a promoter of oral health in our setting? So those are the questions that we want to ask. All right, so that moving now from ethical issues, we can breeze through the rest. It's much easier. Technology, for example, for diagnostic innovations, we now have CBCTs, that is the 3D view of the dental structures. We have digital radiography, AI-enhanced imaging, etc. So all these enhance and speed up and also improve the accuracy of diagnosis. Intraoral scanners, for example, improve precision and patient comfort. You remember when you could use your impression material and you put it in and then the patient gags, yeah, because the stuff is going through the throat. Now we don't have to do that. You have the scanners, some of them are so tiny, you just use it and it's very fast and you're good. How to keep those models? You remember before? I remember I used to have a whole cabinet of models that we poured, and it's so hard to go and find the one that belongs to Dr. Mutara in this place. It's so hard. You have to go through those, you pull one, you check. But now with the digital, you just type Dr. Mutara, all the impressions that you've taken for her, they appear there. And you can even check over time how the occlusion is changing. Pretty good, okay? So I think that is very useful. Treatment enhancements like using CAD/CAM, 3D printing, which you can do on the site, and the patient walks in, and within 4 hours they have a brand new crown, and they go. I'm sure some of you are doing that. Guided implant surgery, I can say because of 3D printing, the digital workflow, I'm able to do more flapless surgeries for implants than ever before, where I don't have to cut the soft tissue. Remember, every time you cut the gingival tissue, you raise a full thickness flap, you're going to have bone loss, okay? So to avoid that and to decrease the chances of infection, then you just do flapless. And you can't do that unless you have the precision provided by CBCT and intraoral scanners. So I think that's a big plus. We have newer regenerative materials and biomimetic in dentistry now. So that is something that can really help us. Again, how do you run your practice? Now we have electronic medical records. A lot of you guys use, maybe just to see how many people are using digital or electronic medical records. I just want to see the uptake. Yeah, almost like 30%. I think it's high time we really talk to these developers and just push a few to make very good software that most of us can use. And if one of you is a businessman, please make sure you get one. Hasif, yeah, you make one nice one and sell it to us. Subscription, 500 bob a month. We are good. All right. Asif is going to do that. All right. So I just want to show you a video of what AI, for example, now the latest entry in technology, what it has done for us. Okay. So just watch this guy and see what that has. Pointed to a clear pattern, explaining what I was looking at. She gave you that look. You know, this here's the thing, she's not wrong for being suspicious. When I show patients black and white x-rays, they see nothing. I see everything. That gap creates doubt. So I created an AI company to bridge that gap. Now when I show Mrs. Johnson her x-ray, the AI highlights the cavity in brightly. There's no medical jargon. She can see exactly what I see. But here's the magic part. She doesn't think I'm trying to sell her something. AI has no agenda. It's just showing me facts. Yesterday, Mrs. Johnson looked at her highlighted x-ray and said, oh wow, I actually see that. Case accepted, no pushback, no suspicious looks. I've been using AI in my practice for the last 4 years, and our case acceptance went through the roof. Patients trust they can see for themselves. Yep. Makes sense? I think that's pretty cool. And so we have no choice but to accept AI is here with us. It's here in digital dentistry. You've seen what it can do. So balancing technology and humanity. Of course, as we get all this technology coming in, self-governing kind of technological advances, I think it is important not to lose the human touch. There's nothing like when you go, oh, and how is your baby? Yeah, to the patient. Oh, it must be in year one or whatever. And you're talking to the patient and they're feeling very nice as you're connecting and they're relaxing. And then you can treat them. I don't think a machine will be able to do that exactly. It might, with AI, maybe it may know some algorithms that are able to ask those questions. But I don't think the person responding back will feel the same way if they were talking to another person. So I think don't lose that human touch. So technology should enhance, not replace the dentist-patient relationship. People want to connect with the person that is treating them for them to really feel well. Think about the risks of technology, AI, etc., over-reliance on these technologies, data privacy, depersonalization, and especially like this data privacy. I'm not sure most of us have seen AI now on WhatsApp and your phone, you're trying to type something and it's taking now 200 years before the text, starts to type in, because all this technology coming into your phone is slowing down your machine. So you're asking yourself, what is going on at the background? You don't know. So it's important for us to be careful even when we adopt these things. What about the ethics and empathy? Let it remain irreplaceable. Okay. Another video. I like movies, so please watch this one. Well, the robot is doing the procedure, and the dentist
observing that all this is planned, it's pre-planned, and that's what the AI does. And really, it's here, and we're in the infancy stages right now, but it is being used even today in some of our procedures with our diagnostics, when the x-ray, the AI is looking at it and saying, oh, okay, I'm going to show you a camera. So we're using it, developing crowns right now with the Sarah. There's AI software, and it's creating crowns for us, but the AI that they're talking about, it's autonomous, it's going to do the preparation. And the dentist will be there observing, the staff will be there, but it's just an AI to help us see the job very precisely, and it's going to be
Great. Okay, good. Sorry, I'm looking for how much time I have left. So, all right. So you can see what AI is doing. You can see robots are coming in. They're able to cut crowns at a faster rate than you. So if I'm the businessman, I own the chain of dental clinics, who am I going to employ? You or the robot? What ethical issues will there be? So think about those things as we move on. So moving next to the professional accountability issues, these are now legal and regulatory matters. We know that, as somebody said, you got to comply with the regulatory body, Kenya Medical Practitioners and Dentists Council, as these regulations coming up all the time. The issues of data protection. Now we must have the data what? What do you call those certificates, yeah? For data protection. You have to have that. OSHA, you have to, there are county health regulations, etc. And all these things we need to comply. And sometimes to get this information is not easy, what you're supposed to do. So these are things that are coming up. We need to catch up with them. You must maintain proper records and patient confidentiality. And as we said, informed consent. All right. So what about the licensing and quality assurance? You'll need all these annual retention requirements like CPD points and all that. And how do you make sure that actually this person has attended the CPD seminar? Dr. Malenya, you remember the discussion at the Medical Council, and people have all these different ideas of what we must do to make sure, for sure, you attended the CPD. And do we give you an exam after the CPD? You've passed or failed? What do you do? But every time, making sure we don't overregulate all these things, okay? There's the issue of advertising and ethics and social media policies. We've seen people that are really putting in material online that is not supposed to be there. So those are things that we need to think about. What about the legal risks like negligence claims, documentation lapses, etc.? Okay, so those are things you need to do. Mentorship, collaborations, like what we are doing today, you know, this is a form of mentorship. There are people who are going to learn something here, and it's going to make a difference, yeah? And I remember KDA was trying to work on a very serious mentorship program. I hope it has succeeded. Okay, referral systems. When we refer, do you get your patient back? Do you get a report? Do we maintain that professional kind of relationship? Okay. So then the aspects of leadership. Okay. There are aspects of leadership where you're trying to help other people to, you can see the smile there. Somebody's about to cut my mic off. Yeah, but think about this. I think as I finish, I think you need to think about a mentor who shaped your ethical or professional journey. Just think about it. Did they make a difference? What qualities made them stand out? And how can you emulate those traits in your practice? Okay, so let me just give that last one there. This is the framework I was talking about, the elite framework of making sure we have excellence, and that is ethics, lifelong learning, innovation, teamwork, and excellence. So finally, the best way to predict the future, I'm not putting that slide here. The best way to predict the future is to create it. So we are not going to sit here and think AI is coming, all these legal things are coming, and we are not doing something about it. And I think this is what KDA really wanted us to discuss these things, and you're going to hear them in different ways, scientific papers, research work, personal opinion, experiences that many people are going to present in this conference. And I think that will help us to face the future. So thank you very much. All the best for the rest of the conference.
Thank you, Dr. Mulli, for that enlightening presentation. We'll take a few questions from the audience. You can raise your hand if you have a question.
Thank you very much, Dr. Mulli, for your excellent presentation. What did you say is the role of training of dentists or dental professionals in ensuring excellence, which is the art of your presentation? Number two, does uptake of technology, in whichever way you look at it, a silver bullet to excellence? The other side of this is it still possible for one to be very good and do very good dentistry, good work, clinical work, with minimum input of technology? And the third one, which is, can technology, as now we know it, also be intrusive or misused to the extent it denies us the very excellence that we are looking for?
Okay, so I don't know whether to answer that and then somebody else asks, or I wait for all of them. Answer this. Okay, so I mean, like training, that's the foundation of the profession, isn't it? You got to get the right training, and you got to keep training on and on and on. And I think that's why we brought in the aspect of CPD, just to realize that you can't say, I'm a dentist, I've been doing this, I know what I'm doing, and you stay there. I think it is good for you to keep learning. And you learn to the point that you can say, I can no longer do this. You know, like I learned so much that I learned I can't do a root canal treatment. You see what I mean? I leave that to Diani and Simiyu and others. So, and there are very good dentists here who have invested a lot more in endo, and they do it. So I think training is paramount in advancing the profession. Don't forget the training institutions are also the ones who are heavily involved in research and development, and they're the ones to give the solutions for not only now, but even the future. So I think training is a keystone. In terms of you trying to avoid tech and become very good, I don't know how you're going to become so good with for root canal and you're not transiting to rotary instruments. Yeah, they have their place and they're better. They're definitely better at doing things. Yeah, right now with your endo, rotary, whatever, as you're working, you can even tell the working length. When you're doing it the conventional way, you have to kind of do that and then go take an X-ray, expose the patient again for you to be 100% sure. But with technology, You just take one IOPA, you do the rest, and you can do your final IOPA and you move on. So I think technology, you can't avoid it. Can't avoid it. If you avoid it, please throw your phone away right now. For once, it's not possible. We are here and it's here to stay. Can tech be bad? That's what I understood. I mean, can it be bad in our setting? I think it might at some point if it's autonomous and taking away our position, especially what I was explaining, relating to the patient, talking to the patient. That connection by itself is healing. So I think I wouldn't think of a situation where tech replaces us totally. No.
Thank you, Dr. Mulli. A big round of applause for Dr. Mulli, please.